Dr. Felicia Otchet.
It's estimated that only 1/3 of adults in Canada who need mental health services actually receive help. If you can afford to pay for help, you can get service by the end of the week. If you can't afford to pay for help, what happens is you usually have to wait. And we know that waiting disproportionately disadvantages marginalized people. The waitlist clinic aims to fill that gap by providing support, by providing assistance, by providing monitoring. We can get to know people well enough to know more about what would be most helpful, and we can then communicate that information back to the agency for which they're waiting to optimize what gets offered. When people get a service they need when they need it, they're more satisfied people, and their quality of life is certainly improved. Another way our service improves the quality of life is through what we can offer to students. They want to be putting what they're learning to use. And particularly for graduate students, they don't get many opportunities to learn how to supervise. So in our setting, we're able to provide those students with something that they need as well. The way the clinic is arranged, we have 4 treatment rooms. In each of those treatment rooms is a camera with a live and encrypted video feed that goes into a large conference room. In that conference room, we have our supervisors. In the middle of the session, the student will come out of the room, we'll provide them with some feedback. They'll go back in, complete the session, and then get additional supervision. The other thing those cameras do is to allow us to quadruple our capacity, so we can see up to 4 different people simultaneously. Students bring their diversity, students bring their different academic training, their different life and lifestyles, and so when we're all in the room and sharing our perspectives, it really enriches the learning that we all take away from this project. I'm extremely proud to be recognized as a finalist, and I'm extremely excited for the clinic itself. We've received a lot of attention from the psychology community in London and beyond, but this is our first real opportunity to have the broader London community know about what we do. We really try and reduce the suffering for people who are waiting. We're not replicating the service that people are going to receive. We're simply trying to provide support and to let people know that they're not alone and that we do care.